Hi, good morning, Thompson. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 18th of November 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Thompson Richmond.
All right, Thompson, could you please confirm your candidate number?
Yes. My candidate number is 430330230.
Fine. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Thank you. Now, let's move on to the warm-up session. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihiraa.
Can you describe a challenging situation you faced in your nursing career, and how you handled it?
In my previous role, we experienced a sudden surge in patient admissions during a flu outbreak. The increased workload and limited resources required effective prioritization. I organized a team meeting to ensure clear communication, established priorities based on patient acuity, and collaborated with colleagues to provide quality care under challenging circumstances.
How do you ensure effective communication with patients and their families?
I prioritize open and empathetic communication. I take the time to listen to patients and their families, ensuring they understand their care plans. Using clear and jargon-free language, I provide information, answer questions, and encourage them to share concerns. This approach fosters trust and promotes a collaborative healthcare environment.
How do you handle a situation where a patient is dissatisfied with their care?
I approach dissatisfied patients with empathy and active listening. I aim to understand their concerns and work collaboratively to address issues. If necessary, I involve the healthcare team to find solutions. It's crucial to prioritize patient satisfaction while ensuring quality care, and I always seek opportunities for improvement based on feedback.
How do you stay updated on the latest advancements and evidence-based practices in nursing?
I am committed to lifelong learning. I regularly attend workshops, conferences, and webinars to stay informed about the latest advancements in nursing. Additionally, I am an active member of professional organizations, participate in relevant training programs, and engage in peer-reviewed literature to integrate evidence-based practices into my nursing care.
How do you handle a stressful or high-pressure situation in the workplace?
In high-pressure situations, I remain calm and focused on the task at hand. I prioritize tasks based on urgency, communicate effectively with the team, and delegate responsibilities when needed. Taking short breaks for self-care, such as deep breathing exercises, helps maintain my composure. I believe in the importance of a collaborative and supportive team during challenging times.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good afternoon. My name is Thompson Richmond, one of the nurses working in this emergency department. How may I help you today?
Nurse, I have experienced breathlessness and persistent coughing lately.
I'm sorry for you. Before proceeding, can I have your name and age for documentation?
Yes, my name is Mihiraa. I am 58 years old.
Thank you for the details. I understand you've been having some difficulty breathing. Can you tell me more about your symptoms?
Yes, Nurse Thompson. It began about 3 months ago, and recently, my cough has gotten worse. I find it harder to catch my breath, especially when I'm doing anything physical.
I appreciate your sharing that, Mihiraa. Can you elaborate on any specific triggers or patterns you've noticed with your symptoms?
It seems to get worse with smoke exposure and in cold weather. Lately, I've been waking up in the middle of the night with a persistent cough.
Thank you for providing those details. How would you describe the nature of your cough? Is it mostly dry, or do you bring up any phlegm?
It's mostly dry, but I do bring up some clear white phlegm at times.
Got it. Besides the cough, have you noticed any chest pain, wheezing, or increased fatigue?
No chest pain, but there's wheezing, especially when I exert myself. And yes, I've been feeling more tired than usual.
I appreciate your sharing all of that, Mihiraa. Based on your symptoms in the initial examination, it seems you may be dealing with an exacerbation of chronic obstructive pulmonary disease, COPD. I recommend further evaluation and hospitalization for closer monitoring and appropriate treatment. I understand it might be concerning, but it's essential for your well-being. Do you have any concerns or questions?
Admitting to the hospital. I was hoping to get some medication and go back home. I don't like staying in hospitals.
I understand, Mihiraa. Being in the hospital can be challenging, but it's crucial for managing COPD effectively. Let me explain why hospitalization is necessary and address any concerns you may have.
Well, I prefer being at home. Hospitals make me uneasy.
I understand your concerns, Mihiraa. COPD can be a serious condition, and in some cases, hospitalization is the best course of action to manage it effectively. May I ask, what specifically concerns you about staying in the hospital?
Well, I prefer the comfort of my home, and I'm worried about the hassle of being in the hospital.
I completely understand your feelings. Being in the hospital may seem inconvenient, but it's crucial for your well-being. COPD can be unpredictable, and being in a hospital allows us to closely monitor your condition, provide timely interventions, and ensure your comfort. It also allows us to administer treatments more efficiently than if you were at home.
I'm just scared of being away from home, and all the medical stuff.
I empathize with your feelings, Mihiraa. It's entirely normal to feel uneasy about being away from home. Given your current health situation, untreated COPD can lead to severe attacks. Managing such issues at home might be challenging, especially if you encounter significant difficulties. However, choosing to stay in the hospital allows us to address your symptoms more effectively, administer necessary treatments promptly, and closely monitor your progress. This approach substantially minimizes the risk of complications and ensures your safety throughout the treatment process. I trust that the information is clear to you.
Yes. I guess you're right. It's just hard for me to accept.
I appreciate your honesty, Mihiraa. I want you to know that our team is here to support you every step of the way. We'll do our best to make your hospital stay as comfortable as possible, and we'll work together to address any concerns you may have. Your health and well-being are our top priorities.
Okay, Nurse Thompson. I'll trust your judgment and stay in the hospital.
Thank you, Mihiraa. Your cooperation is vital for us to provide you with the best care possible. If you have any questions or concerns during your stay, please don't hesitate to let us know. We're here to help you through this process.
Thank you, nurse. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.